Hello, my name is Rebecca Guitron. I am a nursing student at Indiana State University. This video will be on breast cancer, and it is part of the Community Health Nursing course, Nursing Completion 444, part of the LPN to BSN distance program here at Indiana State. The population at risk for breast cancer are women who are older than age 50. Although older women are not the only population at risk, this includes anyone with a family history of breast cancer. The closer the relative, the greater the risk. For example, if someone has a sister or a parent or a brother who has had breast cancer, that person is more likely to get it, up to 4 times more likely. Although it is not common, men can also get breast cancer. About 1 in 100 cases involve men. At this time, please pause the video so you may take the pre-test, which is listed below in the description box. From there, you will take a 10-question quiz, and you will take that again at the end of this video. Learning objectives. At the end of this video, viewers will be able to define breast cancer and what it is, recall the population at risk, identify the risk factors associated with breast cancer, and the viewer will also be able to list ways to reduce the risk of developing breast cancer. What is breast cancer? Breast cancer is abnormal or excessive growth of cells in the breast tissue. This may spread to the blood and lymph vessels. When it spreads to other tissues, the blood or lymph vessels, this has become metastatic. There are many forms of breast cancer. However, the two most common types are invasive ductal carcinoma. This is where the cancer cells originate in the ducts of the breast. And invasive lobular carcinoma. This is when the cancer cells originate in the lobes of the breast. Please take a moment to look at the picture to the left on your screen. It shows the basic anatomy of the breast to help you better understand where the different types of cancers originate. Some other less common types of breast cancer include Paget's disease, medullary breast cancer, mucinous breast cancer, and inflammatory breast cancer. This video is not focusing on any specific type of breast cancer, rather the entire umbrella of breast cancer. And although this is not considered breast cancer, ductal carcinoma in situ, DCIS, is a disease of the breast tissue that might turn cancerous and also increases the person's risks for getting breast cancer later. The top 2 greatest risk factors for breast cancer are being female and being older or aging. So this means women who are 50 or 55 years and older, they are at the greatest risk for developing breast cancer. Other risk factors include family history and genetics, women who have relatives with breast cancer, or men who have relatives with breast cancer. The closer the relative, the greater the risk. For example, a sibling or a parent with breast cancer would mean the person is at a greater risk than if it were to be a cousin or a second cousin. Personal history of breast cancer. If a person has had breast cancer before and has survived, he or she is up to 4 times more likely to get breast cancer again. If a person has had exposure to radiation at some point in their life, especially to the chest and head area, chest and neck, where a lot of lymph nodes are, this exposure to the radiation greatly increases the risk factors for that person. And also having any previous benign breast tissue growth. Obviously, this does not mean cancer. However, if a person has had any previous growth in the breast tissue, this can also increase their risk for getting breast cancer. Some more risk factors surrounding breast cancer involve race. For example, white women are the most likely race to get breast cancer. Obesity and lack of exercise. Overall sedentary lifestyle contributes to a person's risk factor of getting breast cancer. Menstrual history. Women who have had their first period before age 12 are more likely to develop breast cancer. History of hormone replacement therapy use, HRT. Women who have been pregnant after age 30. This is also known as a geriatric pregnancy. Those women who have had a pregnancy after age 30 has an increased risk of developing breast cancer. History of alcohol use. This does not need to be alcohol abuse. Any alcohol use may increase the risks of developing breast cancer, as well as smoking. Smoking increases the chances of developing breast cancer. Not all risk factors can be reduced. However, there are ways to reduce some of the risks. The risk factors that cannot be reduced include genetic and family history of breast cancer, age and being female, someone's race, etc. Ways to reduce the breast cancer risk include daily exercise, abstaining from or limiting alcohol, smoking cessation, which means quitting smoking, eating healthy, incorporating more vegetables, fruits, and water into the diet, talking with your doctor about any risk factors you may have, talking with family members about any potential breast cancer history, self-examination, feeling for lumps, tenderness, and new growths in the breast tissue. This should be done often. Usually it's recommended to be done at least once a month. And getting screened by your doctor. Although not all breast cancer may be treated, there are multiple ways to treat breast cancer. The treatment depends on multiple factors, including the location, severity, type, and characteristics of the cancer cells in the breast tissue. Treatment may include surgery, drugs, which are usually chemotherapy, hormones, or immunotherapy, and radiation therapy. These are the references used for this video. Please don't forget to take the post-test listed below in the description box, as well as take a look at the brochure, which is also included in the description box below. Thank you for watching.